Good morning, students. Can we start with the next class?
Good morning.
Good morning, ma'am.
Good morning, ma'am.
Good morning.
Good morning, ma'am.
Good morning. Myself, Dr. Ashwini Nuchhi from Department of Anatomy. Today I speak about some more anatomical terms, the medical terms, and little about the body donation. The anatomical terms or the medical terms helps you describing certain organ or the structure with your teachers or the peer group. It also help you describe an organ system scientifically. That's why you should know the anatomical terms or the medical terms. The terms which are used to describe the bony features are the linear elevations, or there may be the depression or a cavity within the bone. So the linear elevations are, it may be a line, simple line, or a lip which is margining a fossa, then ridge and the crest. Now we'll see each of these on the bone. See, this is a pectineal line present on the posterior surface of the femur. It is just a line. These elevations, they come out of the surface. The markings may be either a simple line, which is a line, this is pectineal line, or it may be, you can see here on the posterior surface of the femur, there is a ridge called as, this is linea aspera. This ridge is more elevated from the surface. So you have two more lines or the lips which are bordering the ridges. These are called as lips. Like these lips will limit, this is nothing but the line which is extended more in length. It limits the bony ridge, such as the medial lip and the lateral lip of the linea aspera. Then, if the elevation is more pronounced, more thick, then it is called as ridge. Like that we see, this is the orbit. Over the orbit, we can see a ridge, that is supraorbital ridge, which is prominent in case of males. Then if the ridge is more pronounced, covering a larger area, then it is called the iliac crest. It is called as crest, which we can see, this is a hip bone. The upper part of the upper border of the ilium is called as iliac crest. Then if it is a sharp elevation, like the bony part will be protruding out from the surface, such as this is the spine of the scapula, and this is the needle or the hook-like process coming out from the mastoid process, temporal bone. This is styloid process. Then cornua or the horn, it's a horn-like process which is present over the body of the hyoid bone. This is cornua or the horn. Here we can see two horns, the lesser cornua, which is smaller, and the greater cornua, which is larger. This is the body of the hyoid bone. These elevations will, it may be sharp elevation or a linear elevation, which will give attachment to different ligaments and the muscles. Then the rounded elevations, which are called as tubercle, tuberosity, epicondyle, condyle, trochanthus. This is the head of the humerus. It has two rounded elevations called as, this is the lesser tubercle and this is the greater tubercle. These tubercles, they develop as a result of traction by the muscles. Then the radial tuberosity, which is present just below the neck of the radius. This is the rounded elevation covering a smaller area, hence called tuberosity. This also gives insertion to the tendon. Then we have trochanters. These trochanters are also the bony elevations develop as a result of pull by the muscle. This is the upper end of the femur. Here we can see the greater trochanter and lesser trochanter, and they also give insertion to the muscles, origin and insertion to the muscles. Then the lower end of this is the lower end of the femur. In the lower end of the femur, we can see the condyles. This is the medial condyle and lateral condyle. These condyles are nothing but the knob-like elevations of the bone. So above these, we have the bony elevations, which are called as epicondyles. The word epi means upon. These epicondyles are present upon the medial, the condyles, hence they are called as epicondyles. These condyles, medial and lateral condyles of the femur, they articulate. They mainly help for the knee joint, for the formation of the knee joint. They articulate means they join with the tibia below and forms the knee joint. They are mainly articular, whereas epicondyles, they give attachment to the muscles and the ligaments. Suppose the surface of the bone is depressed inside. We have different depressions like that: pit, fovea, the fossa, groove, or the notch. Here we can see numerous pits on the inner surface of the skull bone. The upper part of the skull bone is called calvaria. We can see the pits inside the calvaria or the skull cap. These things. These pits are formed by the invagination of the arachnoid granulations. They lodge the granulations. These arachnoid granulations, they help in the absorption of the CSF. If that pit is more deep, then it is called fovea. This is the upper end of the femur. Here we can see a large pitted area, which is called as fovea centralis. This gives attachment to ligamentum teres, through which the blood vessels will enter into the head of the femur. Then, if the depression is longitudinal, then it is called groove. This is called bicipital groove or intertubercular groove because it is present between the lesser tubercle and the greater tubercle. These are the tubercles, the lesser and the greater. In between this, there is a groove, which is called as the bicipital groove. So even this has the margins, medial and the lateral. Then, if we have the rounded depression like thing, then it's called a mandibular fossa. The fossa, example is the mandibular fossa. This articulates with the condyle of the mandible to form the temporomandibular joint. So this is articular in nature. Then see here, if the depression, it goes inside, like the surface dips inside. This is the upper border of the scapula. It dips inside to form the notch. This is suprascapular notch. The meaning of supra is above and the meaning of sub is below. This is suprascapular notch, which is present along the upper border of the scapula. Through this notch, the blood vessels will pass. Then there are openings in the bone, such as foramina, canal, hiatus. The foramina, these are the openings through which the structures will pass out. In the skull, we can get numerous foramina, such as the foramina magnum, through which the brainstem will extend as a spinal cord. And this is foramen ovale. This is oval shaped, hence it is called ovale. Foramen ovale. Foramina spinosum, the smaller one. Then foramina lacerum. All these are the foraminae which are present on the base of the skull, through which the structures either enter into the skull or they exit out. They come out of the skull. Suppose this foramina, if it is tunnel-like, like it is passing through some bony structure, it is tunnel-like. If it has some length, then it is called the canal. Whereas foramina, it doesn't have that much length. In a 3D configuration, we can see the length and the breadth, but it is not tunnel-like, just a foramina. Whereas the canal, it is tunnel-like, present within the bone. So example for this is the carotid canal, which is present in the mastoid part of the skull, mastoid bone, temporal bone. This is the carotid canal. So this is the lower opening of the carotid canal, through which the internal carotid artery enters. Then it has different parts: ascending part, the transverse, and the vertical part. Then it will come out of the foramen, the lacerum. Here, this is the upper opening of the carotid canal. This is the lower opening of the carotid canal. So it has some length and breadth within the bone. Hence it is called canal. This is the carotid canal. Then hiatus. Hiatus is it's like larger opening. One we can see is the hiatus semilunaris. This opening is shaped like a crescent or the half moon shaped. Hence it is called as semilunaris. Semilunaris means it is half moon shaped or crescent shaped. This hiatus is semilunar shaped or half moon shaped, hence it is called hiatus semilunaris. Here we have the openings of different air sinuses. This is the lateral wall of the nose. The hiatus semilunaris is present in the lateral wall of the nose. Then if we have the cavities inside the bone, they're called as sinus or the antrum. A cavity within this is the frontal bone. A cavity within the frontal bone is the frontal air sinus, and a cavity within the sphenoid bone is a sphenoid air sinus. Here we can see these are the cavities or the air sinus. These air sinus, they are important for making the skull bone lighter, and they add resonance to the voice. Otherwise, it will be the dull voice. And they also help for the humidification and air conditioning of they will adjust the inspired air for the temperature and the humidity. Like that, we have in the mastoid, the maxillary bone also, that's called maxillary sinus, and ethmoid, the ethmoidal air cells. Then antrum, mastoid antrum. Antrum, this is also a cavity within the bone which is present in the mastoid bone. This is filled with the air cells, similar to the sinus which we have seen here. Antrum is also a cavity which is filled with the air cells. This mastoid air cells, they make the skull bone lighter. Mastoid air cells. This is mastoid antrum filled with the mastoid air cells. So we have seen different bony features such as the linear elevations, which are the line, lip, ridge or the crest, depending on its length and the breadth. Line is like line, linear elevation. Lip, if it lines a bony ridge. Then crest, if the ridge, it extends over a larger area, then it is called crest. Then sharper elevations, they come out of the bony surface, such as the spine of the scapula, styloid process. It may be like a needle, which is a styloid process. Then if it is like a horn, it's called conua. Then if it is, the elevation is rounded and it has some breadth and length because they are larger, the greater and lesser tubercles, the radial tuberosity. These rounded elevations, either they give attachment to the muscles and ligaments or they will help in the formation of the joint. They articulate. They are connected with the opposite bone to form the joint. Then the trochanters, they are projected out. Then the condyles, the knob-like bony processes. And over that, if we have some bony elevations, these are called epicondyles. Then depressions. Suppose the surface is dipped inside. You can see the pits, smaller depressions. If the smaller depressions, some more larger pits, they are called as fovea. Then the bicipital groove, which is a longitudinal depression, this lodges the tendon of long head of biceps. So these depressions or the bony depressions, they help in lodging something or give attachment to the certain ligaments. In the bicipital groove, this will lodge this will hold the tendon of the long head of biceps. Then if the depression is including a larger area, such as fossa, which will contribute for the formation of the joint. Then if the some border it dips inside, it forms a notch, such as suprascapular notch, which lodges like it contains the blood vessels and the nerves. Suprascapular nerves and the vessels. Then, if there are openings, we call them as foramina, canal or the hiatus. Foramina is the one which is the small hole like through which the structures will pass. The canal is the one which has a more area of coverage. It is like a tunnel. Then hiatus, it is oblique. And depending on the shape, it is called by different names. Then if the bone has cavities inside, they're called as sinus and the antrum. These cavities also perform some functions. The sinus will add to the resonance and humidifies the air, inspired air, whereas antrum, it makes the skull bones lighter. So those are the bony features which we can see while studying different bones, the osteology. Now we'll learn about more terms, medical terms. The laterality. Unilateral means it is pertaining to one side. That is related to one side. Then bilateral, if it is related to the parts of the same parts of both the sides. Ipsilateral, it is same side but different parts of the body. Contralateral, different parts of the body of opposite side. Suppose for example we describe paralysis. The paralysis is the person can't move the body parts. Here, in unilateral paralysis, it is paralysis of the limbs. That is, this is the lower limb, or you call it as leg. So, in anatomical terms, it is called as lower limb. The leg is called lower limb, whereas this is called the upper limb, which we call you as hand. But hand is not a proper medical term. This is called upper limb. This is called lower limb. Unilateral paralysis of lower limb. That is one side. Then bilateral. Both the lower limbs are paralyzed. That is bilateral paralysis. Then ipsilateral. Same side, the upper limb and lower limb are paralyzed. That is ipsilateral paralysis. Then contralateral paralysis. The opposite parts of the body are paralyzed. Here the left upper limb and the right upper limb are paralyzed. So this is about the laterality, such as unilateral, bilateral, ipsilateral, contralateral. Then if you want to describe about some structure, some muscle, vessels and all, you should describe that the relation of some structure which are above that are the superficial, which are deep to that are the deep structures. Suppose we use two terms such as superficial and the deep. Superficial structures are the one which are nearer to the surface. Or if you are dealing with a bone, describing about the bone, which are above that are the superficial structures. Then deep, below that are the deep structures. Inside this core of, so this is a section of a limb. We can see outside with the skin, then superficial, deep fascia, muscles and the bone. So deeper structures are the muscles and the bone, whereas superficial structures, skin, the connective tissue will be the superficial structures. So superficial is the one which is nearer to the surface, and the deep is the one which is deep inside. Suppose you are explaining about this bone. So above this are the superficial structures, deep are the deep structures. Then the medial structures, which are nearer to the body, median line. The structures which are away from the median plane are the lateral structures. Then the structures are within some sheath or the cavity. Then we use internal and the external. The internal, the word, it gives a meaning of inside. Some structure is present inside. See, here you can see the femoral sheath. This is a connective tissue sheath which is around the vessels, the blood vessels. This sheath, it protects the blood vessels. So the femoral artery, femoral vein are present inside the sheath. They are internal. Whereas this femoral nerve, it is outside the sheath, which is called external. External means outside. So we can, using these two terms, we can explain whether some structure is inside or outside. This is the sheath. So blood vessels are inside the sheath. They are internal structures, whereas this is external structure. Femoral nerve is external. Then suppose the surface, it dips inside. It is called invagination. The surface folds inside. This is evagination. Suppose the surface folds outside. This invagination, evagination, we can see in different processes in the cell also. And particularly in the GIT, the epithelium, it dips inside to form the intestinal glands. These intestinal glands helps in the secretion of enzymes and the intestinal, the other secretions which help for the digestion. Whereas evagination, the surface comes out, protrudes out, which are called as villi, which helps for the absorption of the intestinal, the contents, whatever we have. So invagination is a infolding of the surface. If the surface protrudes out, then it is called evagination. Then the skeleton forms the framework of the body. This mainly consists of the bones, joints, cartilages, and the ligaments. There are 206 bones in the adults, whereas in the children, they vary. They fuse in the adult life and form a single bone. The 206 bones, they are grouped into two divisions or the two parts, such as axial skeleton and the appendicular skeleton. The axial skeleton, it is present in the axis, the central part of the body, such as the skull, the vertebral column, the sternum, and the vertebral column, and the ribs. They form the axial skeleton, which forms the central axis of the body. Whereas appendicular, they forms the limbs, the one which is there in the upper limb and the lower limb. And the appendicular skeleton, consisting of different bones. So that is about the different anatomical terms related to the bony features, and also some terms to explain the structures. Now I'll speak something about the body donation, which you should know. Like body donation or anatomical donation, dehadan, or body bequest. So body donation is called by these many names: anatomical donation, dehadan, body bequest. It is the donation of a whole body after death for the purpose of medical research and education.